Good afternoon, I am Jose Padilla. Today, we are going to review the cardiopulmonary resuscitation in simple steps. Sudden cardiac arrest is the leading cause of death of the American in the United States. They take around 500,000 persons dead during each year. If you do the mathematics, nearly 450 persons die every day, and each minute, one person dies. Early resuscitation is the key. Approximately 50% of survival if somebody gives CPR procedures to the victim. Rapid defibrillation also is the key. If the person gets early defibrillation within the 5 minutes, the person can have opportunity to survive 70%. If they didn't have early defibrillation, each minute passed, they lost 10% probability of survival. The sign of the sudden cardiac arrest is unresponsive, not breathing, and the patient don't have pulse. I will show you how to remember the cardiopulmonary resuscitation in 1, 2, 3 and ABC steps. The first step is check the scene. When you arrive to a scene and see somebody lay down in the floor, you want to make sure the scene don't have any danger for you get accident or injury. Step 2, you will check the victim conditions. You want to make sure the victim is unconscious or conscious, right? So you're going to place beside the chest, tap and shout out, and you will check if the person is unresponsive, not breathing, and don't have pulse. Step 3, you will activate the emergency medical service. How do you do that? You bring your cell phone and call 911. If you are alone, you will make sure you activate the emergency medical service first and then begin CPR in the person. If you have more persons in the scene, send somebody to activate the emergency medical service with the 911 number. The letter A, airway. You're going to open the airway, so you're going to make sure you can have the opportunity to check the breathing. That is the step 5. Check the breathing. You're going to place one hand in the forehead, tilt the head back, and you're going to place your ears beside the mouth of the patient. If you didn't hear there, if you didn't feel there in your cheek, that means the patient is not breathing, and you're going to give 2 full ventilations to the patient. Once you do the ventilation, you will see the patient's chest rise. The last step is the circulation. If you check the circulation in the neck and the patient don't have pulse, that means the heart is not functioning, and you will start chest compressions. You need to give 30 chest compressions and depress 1.5 to 2 inches in the range of 1 minute. I will show you now the procedure in a later video.
Shake and shout at the person. If there is no response, first call 911. Second, open airway, listen for breaths, and blow twice so the chest rises. Third, pump 30 times in the center of the chest, right between the nipples. Continue with 2 breaths and 30 compressions.
You're going to repeat this cycle every minute until the emergency medical personnel arrive. Now, I will show you the steps. remember, when you approach the scene, you're going to make sure you're not going to have any danger put in jeopardy yourself. The second step is you're going to open the airway, right? Once you open the airway, you're going to place your ears beside the patient's mouth, and you're going to verify if the patient is breathing. If you didn't hear the breathing, or you didn't feel the breathing, or you didn't saw the chest rise, that means the patient is not breathing, and you're going to give 2 full-blown ventilations. So, maintain the airway open, close the mouth, and you give 2 full-blown ventilations. Once you finish with the ventilation, you're going to check the patient's pulse. If they didn't have pulse, you automatically going to begin the chest compression. You're going to place your both hands in the center of the chest, and you're going to give 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 22, 23, 24, 25, 26, 27, 28, 29, 30. Once you finish the compression, you will redo the cycle again. 2 ventilations and 30 compressions until the ambulance arrives. Once the ambulance arrives, you're going to tell them what happened to the patient, to the paramedics, and the paramedics take care of the patient. I do the practice already, and this is my source of information. I looked the statistics of the sudden cardiac arrest in the Arizona Department of Health Service, the American Heart Association, the Washington University Health Department, and the CPRduke.com. Today, we'll review the CPR procedure. We talk about 7 to 10% in the survivability loss if any minute pass. We talk about the signs of the sudden cardiac arrest, how to recognize the emergency and call 911, and the basic steps of the CPR in 1 to 3 ABC steps.